Welcome back to Healthcare for Teens, a channel dedicated to helping teenagers understand more about the different areas of healthcare. Today, we have with us Dr. Jonathan Parsons, Director of the Asthma Center at Ohio State University. Dr. Parsons specializes in pulmonary disease with a special focus on asthma, breathing disorders, and bronchitis. Dr. Parsons, thank you so much for being here with us today.
Hey, thanks for having me.
To start off this interview, I'd like to ask, can you share your journey and what inspired you to become a pulmonologist and asthma researcher?
Yeah, sure. Well, I've been at OSU. This is my 25th year here, so I've been here a long time. And when I went into my residency in internal medicine, I wasn't exactly sure what I wanted to do, to be honest with you. And then I spent some time in our intensive care unit and sort of really fell in love with critical care medicine, which a lot of pulmonologists do as well. And then also went to clinic and really enjoy taking care of patients with pulmonary disease, specifically asthma, particularly because a lot of them are interested in fitness and athletics and sports, and that was a lot of, still is a lot of my interest outside of medicine. So it sort of resonated with me and sort of felt like a really good fit. So I pursued that as a career.
As a pulmonologist, what are some of the most rewarding aspects of your work, and what challenges do you face in the field?
Yeah, that's a great question. You know, one of the reasons why I like taking care of patients with asthma is a lot of times we can make them better uh, and actually get them to a place from where they were fairly symptomatic and having trouble doing things that they wanted to do to a place where they're fairly symptom free and able to exercise and play with their children or be active and whatnot without a lot of symptoms. And that really is a rewarding thing when the patients come back to see you after we decide how we're going to treat them. On the critical care side, I work in the ICU as well. Having people come in who are critically ill and figuring out a plan to quote unquote rescue them from their critical illness is also very rewarding as well. So I like the aspect of my job in the point to the point where I get to do outpatient medicine with a lot of continuity and a little bit of a slower pace maybe. And then I also have the inpatient side on the critical care side where it's fairly intense and exciting in a different way.
Are there any breakthroughs or advancements in asthma research that you find promising or exciting?
Yeah, great question. So I've been doing this long enough to remember what it was like to take care of patients before we had all of the injectable biologic therapy. You may see some of these medicines on TV as being advertised. So basically what these medicines are injectable medicines that help people who have uncontrolled asthma despite our best efforts with what we call conventional therapy. And when I first started practicing, we in those cases had to give people a lot of oral steroids, oral prednisone, which had a ton of side effects. And now we have a lot of therapeutic options through our research to give patients who have severe asthma without all the risks of systemic steroids. So I think that's probably the most exciting aspect of in terms of cutting edge research and therapy in the field that I work in.
And with the surge of artificial intelligence and machine learning, how do you see the future of asthma treatment evolving?
Yeah, so I think one area that you might see this uh, be transduced into pulmonary medicine is with remote patient monitoring. So we have ways where patients can go home and with pulmonary function equipment, spirometers or peak flow meters, that they can measure their lung function at home, and then it can be electronically transduced into our electronic medical record, our database, and we can keep an eye on patients remotely through technology without having them to actually physically have to come into clinic, uh, which is super convenient for both sides, right? It reserves the inpatient or the in-person clinic visits for those folks who are really probably more sick and need in-person evaluation. So that's probably the biggest one. And also on the critical care side, we do have telemedicine and virtual mechanisms that we can actually take care of patients, help take care of patients in critically ill, who are critically ill in remote hospitals through our technology, where in the past they may not have gotten the expertise of folks at big academic hospitals.
Could you discuss any specific research or clinical trials that you're currently involved in, and what potential impact they may have on asthma treatment?
Yeah, so there are a lot of different, as I mentioned before, a lot of different trials looking at different biologic therapies for asthma, different injectable medications, all with the goal of having to cut down on the need for daily use of some medicines and our exposure to oral steroids. The ultimate goal is to reduce the flare-ups that patients have with asthma and to have them reduce the need to use their rescue medicines. And so there are a lot of trials going on looking at different formulations of those medicines. Some of them uh, have become so successful in that you might only have to, depending on the medicine, sometimes you only have to give yourself a shot every 2 months, once every 2 months, depending on the medicine that we choose. And so you can imagine for a patient who has been symptomatic and very impaired to only have to give themselves a shot in the thigh through a little pen 6 times a year, it's a pretty good deal. And all that came from doing clinical trials work and clinical research that we participated in the past.
What does a day at work look like for you?
Okay. Yeah, it depends on the day, right? Uh, so, I have two fairly big administrative roles, leadership roles here at OSU. So, most of my days are filled with meetings and strategic planning. But not long ago, I was a full-time clinician. So what it would, my day would typically start off with getting to the hospital around 7 o'clock and sort of pre-rounding on my patients, coming up with an idea of what we're going to do. And then we would have formal teaching rounds with the medical students, the residents, and the fellows. And we would go through and see each patient as a group and come up with our treatment plan for the day. Then I would write my notes and have meetings throughout the afternoon, go back to the ICU or to the clinic in the afternoon and see the patients again, come up with a closing plan for the day and go home. And so typically my days would be at work, from like 7 to 5, 7 to 6. I work out, I do a workout every day for physical fitness, and I do a lot of mind work, whether it be thought work or meditation, try to do some of that every day for work-life balance. And then my wife is a physician who is also a life coach. So I'm married. I have two boys. They're 21 and 18. So I have two boys in college. So I'm busy, but that's what I like to be.
Yeah.
And I wouldn't do it. I mean, if I had to do it again, I would do it. I'll go over again in a second. I mean, it's just I feel really rewarded and lucky to be able to do what I do.
Mhm. What advice do you have for teenagers aspiring to become medical professionals like yourself?
Yeah, I guess my advice would be don't be intimidated by how long it feels like it's going to take for you to get to your destination. So if you look at it on paper, you're like, oh my, I got to go to 4 years of college, and then I have to do 4 years of medical school, and then a minimum of 3 years of residency, and then I did a 3-year fellowship after that. And you're like, oh my God, that's 14 years of time. But it's no different than if you had gone into finance or other fields where you would be working yourself up the ladder in your organization. It's very similar in medicine. You're sort of medical student, resident, fellow, attending. It feels like it's a long time, but it really isn't. So first advice would be don't be intimidated by the amount of time it takes. And don't the other thing I would say, don't put all your eggs in one basket about being a physician. If that's your ultimate goal, fantastic. But there are other ways, if you're interested in healthcare, that you can contribute to healthcare. You could be a pharmacist, you could be an advanced practice provider, a nurse practitioner, or a physician assistant. You could be a CRNA. I'm about to lose my lights here. 1 second here. You could be a CRNA working with anesthesiologists. There are a lot of ways to become involved in medical care that aren't just being a physician. The options are pretty endless, to be honest with you. Um, so that was the second point. And the third point I would be is don't lose sight of all the things that give you pleasure in life, just at the expense of achieving your goals of becoming a physician. So what do I mean by that? Don't spend 20 hours a day studying. You need to take some time to go take care of yourself. Go develop relationships with people. Go have fun. Go travel. Do things that fill your tank that are outside of studying to become a physician. If you don't do those things, you'll end up being 35 years old. You'll end up being a physician, and you're going to realize that you didn't do a heck of a lot of fun stuff over the last 10 to 12 years because you were too busy studying to become a doctor, right? So then sort of my life coaching kind of things. And I guess the last thing I'll say is don't take yourself too seriously. I mean, yeah, you're a physician, but that doesn't make you better than anybody else. Just treat people like they're your peer, and that'll serve you well in anything you do, in any field.
That's it for this video. And Dr. Parsons, thank you so much for being here with us today.
My pleasure. Thanks for having me.